this sickness so na sickness when we say it don't assume public health concern for many countries, because outbreak day when we say it don't lead to so many deaths for these countries when we say it dey for happen. Now, wetin be dengue fever? Another name for dengue fever na be breakbone fever. When they break bone, as the name suggests, that be the other name for them. And this fever na mosquito na dey carry am. So that is why a day of importance. So you know, say for our land now we get mosquito. So now that kind mosquito when we say if he carry am, if he suck person blood, bite person, suck person blood, then it go give the person the virus when they cause the dengue fever.
Welcome once again to our program for Qalam Radio. Your side ever since.
Well, thank you, and thank you again. It's always a pleasure to be here. So our people will greet you now welcomely. We say good afternoon, good evening, or good morning, depending on where you day. But for our side now, good afternoon. How we day now? We bring Ogbonge topic for us this afternoon to talk about, especially as it be say the thing now it don't become a thing of public health concern in many countries, especially those countries when we say then they tropical and subtropical countries. And now Nigeria belongs to a tropical country. So that's why this thing day of importance to us. So what we will talk about today now dengue fever. So people they pronounce and different, they call it dengue, but it's correctly pronounced dengue. No be English word. So I'm gonna go take on like that. Now, this sickness so now sickness when we say it don't assume public health concern for many countries, because outbreak day when we say it don't lead to so many deaths for these countries when we say it dey for happen. Now, wetin be dengue fever? Another name for dengue fever na be breakbone fever. When they break bone, as the name suggests, that be the other name for them. And this fever na mosquito na dey carry am. So that is why a day of importance. So you know, say for our land now we get mosquito. So now that kind mosquito when we say if he carry am, if he suck person blood, bite person, suck person blood, then it will give the person the virus when they cause the dengue fever. Because the fever is caused by a virus called dengue virus, and the mosquito when they carry am. Now the kind mosquito when we say most times they fly and bite for afternoon. Unlike the other kind of mosquito when we say they fly and bite for night. And the mosquito they call them Aedes aegypti. That be the name of the mosquito when they carry this virus and when they cause dengue fever. Now, the good thing about this is, or luckily, or thank God, say majority of the cases they mild, because now only 0.5 to 5% of the people when get dengue fever 9 day severe and very life-threatening. Life-threatening in the sense that some people can still die from it. So that we say majority of the cases they mild, mean say it's not something we should be worried about. It's not something we should try and protect ourselves from. So as we said, majority of people when they get them, they without symptoms or they very mild. Now, make we talk about how they transmit this disease, how they carry am from person to person or from place to place. Now when this mosquito, when they call Aedes aegypti mosquito, na be the vector, na they carry am, na be the vehicle when they carry am from person to person, and na from mosquito bite, from the bite of mosquito, of this Aedes aegypti mosquito, na they cause this disease when we talk about. And we don't talk and say this mosquito mainly they fly and bite during the day. It's also known as a diurnal mosquito, unlike the other one we say is nocturnal. Now, nocturnal means say for night, but this one during the day. Now they very active. So, and with peak activity they around say that kind early morning, so or when day one dark, now really they doing work, they bite, they transmit this disease. So if when person get this disease, how they take the show for body? Sometimes if he not just show, the person no go get symptoms, and it may just be mild, it go just pass unnoticed. And if you notice now, this disease, so when by the time we reach the symptoms proper, if they look like malaria, say malaria now, because of where we they live for place like Nigeria, and people when they other African countries, tropical countries, because of our environment and weather condition, we get malaria. So this disease they look like malaria, but no be malaria. Because you just say you get malaria, either you go buy medicine or you take dongoyaro, but this one it no be like that. So that's why no be everything when look like malaria, no be malaria. So typically symptoms they begin 3 to 14 days after the mosquito bite, and this one we call incubation period. So 3 to 14 days, then the symptoms go fit start. And when person get the symptoms, how they present, wetin they show for body, the person fit get fever when be say high, where body go dey just dey hot. Then the person fit get headache, especially they complain of headache, and you go notice na so na malaria, common malaria, na so they present. Then the person feel like say he want vomit. If he still vomit, then he go get pains, muscle pain and joint pain. Then sometimes the person fit get skin rash. You go get itching of the skin, and you go still get rash. Now, usually for people when get this thing, they feel recover within 2 to 7 days. Majority of people when get it, they feel recover within 2 to 7 days. Now, you can't get another set when we say the smaller proportion of persons when we say when they get them, they develop severe disease. That is the feared one. When we say, because if anybody is affected, you don't know how the disease one be, whether it could be the mild one or it could be the severe one. So that is why nobody prays to have it, and we must do all we can so that we go protect ourselves from coming down with this dengue fever. Now, for the percentage when we say we don't put on before 0.5 to 5% of persons when get when we say they progress to the serious dengue fever. These people they fit bleed from anywhere. That's why another name for the severe one they call a dengue hemorrhagic fever or dengue shock syndrome, because these people, just like other hemorrhagic fever like Lassa, they feel bleed. They can bleed from anywhere, from passing urine, from their nose, from their mouth, from going to toilet. They feel bleed. Even women feel bleed as if na menstrual cycle. So another one, once the people don't start to bleed, so that one don't become very serious and feared type of dengue fever. Then they feel just get low levels of blood, what we call platelet. Now platelet, now they make person they feel clot. Like if you injure now platelet go just go form clot for them, then go can't stop the bleeding. So that's because they get low platelet, now make them they at risk of bleeding. Then they also get blood plasma leakage, and because of this, their blood pressure go low and they go get shock. Then if you know if you fit stand, the blood pressure go low, you go dey struggle, the doctor go dey struggle to bring up. So na so the severe one dey present. And most times when patients don dey enter this severe stage, na between life and death. It becomes life threatening. Anything fit happen. So that when we come to prevention, we will see why we have to be very health conscious and do all we can to make sure say this thing affect us or affect our person. Now we fit prevent this thing, yes. So there is something when we say we fit do to prevent this thing from happening. Of course, we don't talk say na mosquito bite na im dey cause am. The special kind of mosquito wey they call Aedes aegypti na im dey cause am. And this mosquito, we don't talk say e dey fly for afternoon. So we go do all we can to prevent this mosquito from biting us. How we fit do this one? One, na to get nets for our houses so that the mosquito no go fit come into our houses, come begin dey bite people. Then another thing wey we fit do, we fit get mosquito repellent. Maybe say we fit use either there are some wey be say you fit rub, some wey be say you fit burn for your house. When be say the smell, the mosquito no go like, and the mosquito go just dey run, dey go. You no go like the smell. Then we go wear special protective clothes. No be that time to take expose, especially if you dey outside. Maybe that time to take expose yourself. So you go wear clothes wey cover you almost completely, like long clothes, trousers and shirts and all that, so that the mosquito no go see how they go take bite the person. But if you be say there are bushes around the houses, you fit clear am, because you know say mosquito dey like bushes and where water for gather, make them take lay eggs and born their children. So you go clear around your houses and good personal hygiene.
All right, thank you very much, Doctor, for that program, for that talk where you just give us like this. Well, for all of this now, me, I dey like clarify some things. So you get one question where we say me for like ask like this. Now you talk about say person they get this fever, but me want ask now, if person don't forget am before, if he get am again, I been a once in a lifetime.
If you still get them again.
If you still get them again.
Yes.
Now wow. So to which stage person go for can know say this one don't pass ordinary malaria, since it also get the almost the same symptom as malaria. How person go tell you say it don't pass the normal malaria would they get to the other one where we say na dengue fever and IV.
Okay. Now let me take the question you asked earlier. Now, people when we see that they get this disease repeatedly or subsequently, maybe second time, third time, they at higher risk of having the severe type of the disease. So that is why nobody should play with what we discuss now. Now, to your first question, or your second question rather, when you get what looks like malaria, you don't take malaria medicine. You know they work. That one will be time to sit down for house. Go hospital. They get tests when they will fit do for you. When they go check, say, now malaria be this, no be malaria. Now because there's an outbreak now. So when doctors, when they see anything when look like malaria, and we say they don't give malaria medicine, they go. The next thing are to suspect, say this one fit be dengue fever, because they present similarly. They look alike. They be like twins. So, because now the same mosquito, though one is Anopheles, the other one is Aedes aegypti, and mosquito bite, and the same way that they take transmitter. So, when doctors say this malaria will be treated, so the Greek go, they will all know say okay, this could be dengue fever, make we test them and make we treat them. So like malaria now, okay, there are differences. malaria now, they enter that severe stage of, say, person come dey bleed, or person come dey get shock, dengue shock syndrome, that one no dey, or dengue hemorrhagic stroke, dengue hemorrhagic fever, that one no dey. So now just the subtle differences be that we no go wait make person come, okay, make we wait, make it whether e go enter the severe disease before we begin. No. So once e just start, say this one, if you no be malaria, you go just suspect dengue fever and you diagnose it and you treat it. So that is how we do it.
Okay, thank you very much, sir. Now true say all these all those malaria drugs like those ibuprofen and or the aspirin feel make this dengue fever worse.
Well, yes, because the person is at risk of bleeding.
Okay.
And when you give those ordinarily NSAIDs, non-steroidal anti-inflammatory drugs, they cause some form of bleeding because of the way when they take act. Yes, so I'm not going to mention the drug name, but that's a group under which they belong. So, but commonly, because these people, they get severe muscle pain, severe joint pain. That's why another name when we call the disease now breakbone. They break person bone, breakbone fever. So they give the person analgesic. Yeah, so we could give other types of safe analgesic, that is painkillers. When we say they go treat the pain, but they no go cause bleeding. They no go put the person at risk because of bleeding. So yes, but you give a lot of fluids, you give painkillers and other many things. When we say we no go fit talk for you because na radio with this. So if you get anything, because before you know now people go come and say, okay, doctor talks in us, so oh yeah, from house we now so we go dey do am. No, so we talk. If you get this disease, if you get this infection, go hospital. They go diagnose you and they go treat you. For some persons, they feel no need admission, no. But the serious one will be say e get as e be, and those ones they will say, okay, this one you need admission. Just like malaria, no be every malaria that they admit. You get some, you go just call, you write malaria message, okay, go house, you go house. Why some will say no, this one serious malaria, you go bed for admission. So now so dengue fever still be too. Majority of people will just outpatients, they just go house with treatment. Why the serious one and they admit. So now so it be.
Okay, no problem. Thank you very much, Doctor. Now, for our listeners where they listen to this Ogbonge program like this, if you get something where you want to concerning this fever, what they talk about, that dengue fever now they call. If you know say you get something to talk concerning this, and or you don't see case or situation of person where you get or you just want to ask question. Doctor, they're available now for this program. So you just call in or you go write us for our number will be 08101269752. Make we hear wetin you want talk concerning this dengue fever. But before we go, because time dey already reach for us to wrap up. But before we go, you get wetin I want ask doctor like this. Now, you talk about say prevention there, but I don't know. I want ask vaccine don there been only just prevention tools 9 day for now.
Thank you very much. Yes, vaccine day for dengue fever. So vaccine day. So for our people, we go use this opportunity to tell them, say make them take advantage of the vaccine, so that apart from the other preventive measures when we don't first talk, yes, you take advantage of the vaccine, get yourself vaccinated against this outbreak when we say we get so.
Okay, now we know say for this our ouchie now for some side, now those wey be say they live for flooded or dirty area and I plenty pass. Sorry to say I dey talk this one on air, but na just the truth be that one. Now for those kind of people who say that they around dirty locality or flooded area, how dem fit to protect themselves?
Well, the first thing, even apart from this dengue and malaria, dirty environment get plenty things when they bring. We know if we talk and finish, from Lassa to malaria to cholera, and it is it's not a good thing. Say person they live for where dirty. Apart from the psychological effects, I mean, you are coming to your place, you are not happy. You see dirty place, your house, everything. It's not good. Whether you be, no matter the faith when you profess, it's not good. Say person house is dirty. So you clean them. That in itself will save you a lot from falling ill, from going to hospital, from you save your money for many things. So in fact, reptiles, snakes, snake bites and all that. So the things too plenty to talk about. So we must encourage our persons, our people, make them keep their environment clean, and the necessary the relevant authority too should also enforce this cleanliness, like the people when they in charge of environmental sanitation and all that. It's a good thing, say, for Edo State now we don't bring back monthly environmental sanitation on the last Saturday of the month. So people should take advantage of this. But you don't even need somebody to come and tell you to clean your environment. I mean, you suppose know, say, my house don't dirty, grass don't grow, this one don't do this one. You clean. This open dumping of refuse, it shouldn't be. There should be regulated refuse disposal where they throw away dirty put, so that they can take care of. Because when you know now, rats and rabbits and snakes and everything, they will have access to our homes. So we know if we talk and finish, make people they take care of their environment, clean their environment, because you help yourself against all these many sicknesses when we talk. So as it relates to dengue fever, yes, cleanliness, we know if we talk cannot be overemphasized.
Okay. Okay. Now, what will be your final word for this dengue fever? What would they talk about today? Waiting, how will it stop this dengue for Nigeria in general?
Well, mosquito we dey mosquito environments, we dey live together. So for that one, the other way when we say we fit prevent them is what we call area spray. If you use helicopter begin dey spray the environment and all that, but we know say for some time now we never see that one for our environment. So now every man na go protect himself by protecting yourself from being bitten from mosquito bite. And you know how mosquito dey bite now, and this one are during the day. So you no go lose guard for mosquito matter. You go make sure say you tighten your end. If you be say you get net 20 for your house, you go arrange them. Then if you get anything what you do for outside, because we say this dengue fever mosquito, the Aedes aegypti, na during the day they bite. So you must dress appropriately, so that at least I never see mosquito when they bite through cloth. If you say they get maybe that one they send and come. So that was on a lighter note anyway. So we dress appropriately, and if you are indoors, also make sure say from time to time you fit use insecticide, spray your house, especially when you go out, so that if there are any mosquitoes, when you see they enter your house, you go fit just buy them inside. So now we go take talk the much reach your environment, you still clean them, because at the end of the day, if anything happens to you, now the person na go bear am. So now we go take advice our people reach, make then if the vaccines they available, then we take advantage for the vaccine. We will take the vaccine. So these are some measures when we say if we put in place to take protect ourselves. Then people when we say they fall ill, of course go to the hospital.
Okay, thank you very much, Dr.